In the United States alone, tens of millions of patients have hypertension. Every day, clinicians make critical treatment decisions to manage their high blood pressure. On November 9, 2015, the New England Journal of Medicine published a randomized trial of intensive versus standard blood pressure control from the Sprint Research Group. The study compared two systolic blood pressure goals in patients 50 years or older with hypertension: a systolic blood pressure of 130 to 180 and additional cardiovascular risk factors. The trial sought to determine if there was a higher survival rate and fewer cardiovascular events with a greater reduction of systolic blood pressure. The first strategy targeted a goal blood pressure of less than 140, and the second, a goal of less than 120. The trial found that patients with the lower target blood pressure had fewer cardiovascular events and reduced mortality. On November 9, 2015, the day the study was published, the UpToDate process began at UpToDate. UpToDate's in-house deputy editors immediately began taking steps to update goal blood pressure recommendations. They assembled a team of 13 hypertension experts from around the world to interpret the Sprint trial and determine how it should impact daily clinical practice. These physicians, all recognized leaders in their fields, are responsible for authoring and editing the recommendations in UpToDate. They are among more than 6,000 physicians worldwide who comprise the expert faculty of UpToDate. Over the next few days, the discussion raises two key issues. First, the study included patients at high cardiovascular risk, but without diabetes, previous stroke, or proteinuria. To which patients should these new recommendations apply? Second, the study used a less common blood pressure measurement method than is used in most clinics. Should the new recommendations for goal blood pressure vary depending upon the method of measurement? The experts share their interpretations and a lively discussion ensues. Over the course of 50 emails and many phone calls, a consensus is achieved. New, nuanced goal blood pressure recommendations are generated that address the target patient population and measurement methods. UpToDate is transparent about the contributors who are responsible for our content. The expert authors and section editors, as well as the deputy editors, are clearly listed at the top of each topic. New treatment recommendations, not just a recap of study findings, are now in hand. Now, it's time to grade those recommendations. UpToDate uses the grade system to assign evidence grades to recommendations. Each recommendation is assigned a number and a letter, so clinicians can clearly understand its strength and the quality of evidence behind it. As with the clinical recommendations, there is lively discussion among evidence-based medicine experts at UpToDate concerning the grades for these new recommendations. Once agreement is reached, the recommendations are fully ready for publication. For non-nursing home patients 50 years or older with a systolic blood pressure of 130 to 180 and one or more cardiovascular disease risk factors, not including diabetes, symptomatic heart failure, a history of stroke, or proteinuria, we make the following recommendations. If blood pressure is measured using an automated oscillometric blood pressure device that averages multiple readings with a patient resting alone in a room, we recommend targeting a systolic blood pressure of 120 to 125 and a diastolic blood pressure of less than 90. If other methods of blood pressure measurement are used, for example, a typical oscillatory manual blood pressure cuff, we recommend targeting a systolic blood pressure of 125 to 130 and a diastolic blood pressure of less than 90. Before UpToDate, it could take 10 years for new studies to impact clinical practice. Now in just 10 days, UpToDate brings world-renowned experts together to interpret new evidence and provide actionable recommendations. As a result of this unique and rigorous editorial process, millions of clinicians around the world have access to the most current, evidence-based recommendations.